There are many techniques we could have chosen to show on the knee, and many areas of the knee on which to have performed them. However, we're going to show a technique which is used to support the medial collateral ligament, which can easily be reassigned to the lateral collateral ligament. For this technique, you're going to need 50mm and or 75mm elastic adhesive bandage, 50mm zinc oxide tape, adhesive spray and taping scissors. Make sure the area to be taped is clean and not too hairy, as this can impede the effectiveness of the tape. Wash and shave the area if necessary. Ask the patient to stand against a table or plinth with their knee flexed to approximately 30 degrees. This is where the collateral ligaments are said to be at their most vulnerable to injury from impact. For this technique, you're going to have to get on your knees. Apply the hypoallergenic balm, underwrap or adhesive spray as applicable to the person being taped. Here I'm using adhesive spray. Because we're going to go around the circumference of several muscles, we're going to use an elastic adhesive bandage for our anchors. In order not to put our anchors on too tight, we're going to pull out our elastic adhesive bandage and allow it to spring back so as not to constrict the muscles too much. Following the natural contours of the thigh, we wrap the anchor around the thigh muscles, making sure that we're above the hamstring tendons at the back of the knee. If you're too low, this may cause friction, leading to discomfort to the person being taped. You cannot tear elastic adhesive bandage the same as you can zinc oxide tape, so you will need to have a pair of tape scissors close at hand. You can use one or more anchors as you deem necessary. The anchors below the knee will follow the same format as for that above the knee. Again, be careful not to impede the tendons behind the knee by going too close to the knee with your anchor. There are no stirrups with this technique, rather we're going to use strips of tape to support the affected region, which in this case is the medial collateral ligament. We build up our strips from anchor to anchor. I like to work across the ligament, then work out in a fan-like manner, always making sure that the tape crosses across the ligament region. You will see many ways of closing a technique such as this. What I'm going to do is to close the anchors by resupporting the whole job using an elastic adhesive bandage. Remember not to pull the tape too tightly around the muscle belly. When changing direction, simply hold the tape in place and follow the zinc oxide tape across the knee joint. Do the same thing when changing direction again. Follow the anchor around the muscle belly, holding the elastic adhesive bandage and following the zinc oxide strips back to the lower anchor. Close all the loose ends of zinc oxide tape. Don't forget to fully close the elastic adhesive bandage above the knee by following the anchors until the tape here is held in place. Ask the patient to stand and have a walk around, and don't forget to ask them how the tape feels and make sure that they can function adequately with the tape on. It's not unusual for the tape to tighten or loosen when the leg is flexed or extended. This is quite normal. Remember, we want the tape to be at its most effective at 30 degrees.